vaccine to prevent the spread of the sexually transmitted disease HPV is now available for the very first time at the Health Services Authority. Starting this week, with their parents' permission, young girls will be given Gardasil, which helps prevent against cervical cancer.
We wanted a pilot project so that we can see how the uptake is, how the interest of the parents is in having this vaccine before we embark in a regular program. For that purpose, we partnered with Cancer Society and the government, and then we obtained a vaccine sufficient for about 150 persons. As a pilot project, decision is made to offer it to girls between 11 to 17 years of age. We are not here to convince a parent it is a must and all that, but we are here to provide the information and you make the decision.
I think they need information. They have to know this, and most parents would like to think, well, my daughter's not going to be sexually active. They don't necessarily know whether they are or they're not. There's also, unfortunate circumstances of abuse in the community. And again, you're offering your child protection. So I think regardless of the circumstances, they need to know.
So what should you know about the human papillomavirus, commonly known as HPV?
HPV infection is probably the most common sexually transmitted infection. Nobody sees HPV, and there's no treatment for HPV. For example, if one is positive for HPV, we cannot say, okay, take this treatment and it's going to be eradicated altogether. However, there's treatment for HPV-related problems, as I mentioned, the warts and the cancers, the various cancers. Even if somebody has a condom, the condom just protects the penis. However, the person could still have the HPV virus in warts on other parts of the genitalia. So if there's contact with whoever they're having sex with, yes, it can be transmitted. A lot of people do have HPV, but they don't know unless it's tested for.
There are 100 different types of HPV, 30 of which are sexually transmitted. Researchers keep track of the various strands by identifying them with a number. For instance, the strands numbered 16 and 18 cause 70% of cervical cancer cases, and two other types, 6 and 11, are to blame for 90% of genital warts. The vaccine works best in young girls who have yet to come into contact with any of those viruses.
This is not a live vaccine. You do not develop, cervical cancer or infection itself from this vaccine. And therefore, the body then produces antibodies against this HPV virus, 16, 18, and 6 and 11. So next time, whenever somebody actually encounters this real virus in real life, it begins to give out antibodies and so prevent the person from actually developing the disease itself. As you know, pap smear is one of our biggest tools to try and detect, cervical cancer at a very early age, so we can actually intervene and stop the cancer from actually forming. All right. So with this successful pap smear program, we've actually seen a reduction in the incidence and the mortality of cervical cancer here in the Cayman Islands. And when this vaccine was finally approved in the year 2006, it's a natural progression that this is actually going to prevent somebody from actually developing cervical cancer. So this is not just early detection. Now we're talking about preventing somebody from actually developing it.
According to the Center for Disease Control in the United States, the vaccine is safe and highly effective. It has been tested on thousands of females around the world between the ages of 9 and 26. So how can you get your daughter vaccinated?
We have appointments. The 26th, when we're going to start, the 26th of August, is already full. And we're moving into the next week, we're getting people calling in and making these appointments. Our clinics are going to be done only once per week. That's on a Wednesday from 3 until 5 o'clock. For the pilot program, it will be done here in this clinic. This is the public health clinic in Georgetown by the hospital. So for the pilot, it's only going to be done here. And all the other district girls can make their appointments and come here.
Don't forget, vaccination program has almost wiped out things like rubella, which is German measles. You don't hear about people really having measles and mumps anymore, and it's because of years of vaccination program. So, it does play a part still in this particular point in time that the virus is out there, and your child can get it. And if your child, there is one life that we save, is worth it.
We monitor the program, how the uptake is, and we are working with the Cancer Society. And Cancer Society is doing some fundraising based on the demand, and then we will decide whether it will continue as a free, because the first 150 are at no cost. After that, whether it will be subsidized, because it is going to cost us actually to get the vaccine in the market. It's about $120 to get the vaccine, and there will be some administrative costs. 120 is per dose. So if you're talking about 3 doses, it is $360, although we are negotiating with the company for a less price. Depending on the funds that will be available from the Cancer Society, then whether it may be subsidized or it may be free.
To make an appointment, you can call the Public Health Clinic at 244-2648. That number again is 244-2648.